Tonight, COVID-19 numbers in Knox County are as low as they were before the Delta variant surge last fall. We want to show you that on a graph here.
That's right. The Knox County Health Department reported about 400 active cases last week in Knox County. Reporter Vinay Simlot joins us with an update on the number of COVID patients in the hospital right now.
Robin, we're seeing hospitalizations dip down too, and health leaders say as we move forward, their goal as cases rise and fall is to keep the hospitalizations low. It's an initiative announced by President Biden at the State of the Union.
So people can get tested at a pharmacy, and if they prove positive, receive the antiviral pills on the spot at no cost.
Now in East Tennessee,
our real goal is to decrease the risk of severe hospitalizations, secondary pneumonia.
Kroger announced they're starting the Test to Treat program at some of their locations. Here's how it works. If you test positive or show symptoms of the coronavirus, a medical provider has to decide you're a good candidate and give you a prescription for an antiviral. It's a drug to stop the virus from replicating once you're infected.
Those antiviral medications are designed to keep your illness mild and not let it evolve into something more serious.
Dr. William Schaffner at Vanderbilt hopes this approach will cut down on COVID hospitalizations and bring down hospital wait times.
The more people we can keep out of the hospital, the more we can bring our hospitals back to what's close to the old normal way of functioning.
Even though the antivirals work well, Dr. Schaffner says preventing COVID with a vaccine is even better.
And we ought to remember what Benjamin Franklin, that founding father, reminded us of. He said, an ounce of prevention is worth a pound of cure.
So to reiterate, you do need a prescription to get the antiviral, and it's not for everyone. For some context, last week the Department of Health reported they had about 259 antivirals in Knox County, while the health department says 403 people had COVID in the county last week. It's for those who are immunocompromised and more likely to have a severe case of COVID. Robin?
All right. Vinay, thank you.